happy Monday. Oh, things are falling over here. How do I? There we go. Okay, my tripod was like all falling over. Happy Monday. Thank you. Got my lunch. This tripod's weird. There we go. So we're live on here, TikTok, Instagram, Facebook, YouTube. Where else? Twitch. So, I kind of try to manage comments and questions from all these different platforms. And I have a question here. The sound is not working. I don't know. Can you hear me now? I don't know. Can y'all hear me? Hi. Hello. Happy Monday. Good. It's working. Yay. I don't know what that was about. So I have a comment here on Instagram. You're struggling right now. And you're waiting to get a possible another diagnosis of, some neurodivergent stuff going on. And, I think that's a long wait list of 1 to 5 years. Damn. That's why I think diagnosis is sometimes a privilege, right? Like, not everybody has the privilege to get a diagnosis. It's cool to have sometimes that clinical professional validation of, hey, yeah, this is a thing that you have, and here's a treatment for it. However, listen, I'm not advocating for y'all to go and self-diagnose online, but you know yourself, you know what you're struggling with, you know what life is like for you. And if you can, I think it's okay to try to do a little bit of your own research and a little bit of your own, try to find your support for that. You don't need a doctor to tell you that something is wrong, right? You know that something's wrong. You know that you're struggling with something. So you were shocked. Yeah. Wow. Can a blood test show anything about how much you're eating? That's a good question. Yes and no, right? Blood tests are interesting data that we can tell a lot about someone nutritionally based on blood work, but also blood work doesn't give the full story or the full picture. I have also seen people who are not in a good place with their eating disorder or any health issues, and labs will come back normal. So they are helpful. Sometimes from labs, we can tell if a person's been purging. We can tell, your labs would more likely show things like electrolyte imbalances or, nutritional deficiencies. So, it wouldn't necessarily say we can't tell you what you were eating or how much you were eating, but we can just kind of see where you're at nutritionally sometimes from those labs. So, calming clods. Dr. Steph, guess what? What? You say this very I don't have words. We're under the weather in my house today. So like my brain is foggy. You say this very enthusiastically. So you have good news. You got a counseling position with Renfrew. That's actually really cool. Congratulations. Renfrew is, I believe, okay, if I'm wrong, y'all can kick my ass, but I want to say that Renfrew is like the first eating disorder program in the country. One of the first, maybe one of the like longer. Congratulations. That's a great program and a great place to learn. Oh, someone is speaking, I think, French to me on Instagram. I wish I knew what that said. I do not read French, speak French. I was a brat as a kid. And whenever it was time to take foreign language classes, I was like, y'all can't tell me what to do. I don't want to learn another language. I regret that now. Because it would be cool to, you know, be able to, like, especially Spanish, because I'm in Texas. And I've heard that Spanish will be like the predominant language eventually. So I kind of missed out. And now it's too hard to learn a language as an adult. I do Duolingo, which helps, but would a body comp be better than for like the labs and the nutritional stuff? Maybe. I mean, you know, I always tell clients when I'm working with eating disorder clients, like a doctor on the team is such a important team member. Doctors can give us a lot of information about where a person is at and where you like want to be. You know, I think it can help clients certainly when they have labs that are abnormal. It kind of helps you have some kind of like incentive maybe, but know that again, I have seen people with severe eating disorders have normal labs. Like they go to their doctor, they have a full physical, full workup, and nothing comes back abnormal. So again, it can be helpful information, but it's not like the end all be all, because sometimes the body is so freaking resilient, y'all. Your body, and I need to be eating. Your body is going to do everything in its power to keep you alive. Even if you're starving, even if you're binging, even if you're purging, your body works really hard to try to like, you know, survive. So that's why sometimes labs aren't the end all be all for information of how things are going, because our bodies can get to, you know, like homeostasis, and they can be so resilient in times of extreme health issues happening. Yay! You had lunch. I'm so glad for you. Welcome. Cheers. If someone is severely underweight but have normal labs, is it still valid? Yes, it's still valid. Like the labs, I don't use that to diagnose people at all. Like sometimes I can diagnose somebody, not sometimes, I can diagnose somebody with an eating disorder and not have any medical information at all. So again, it's helpful. Like it can be helpful. It can let us know where you're at. It can help you maybe have some kind of like incentive or motivation, but labs and medical issues do not need to be present to have an eating disorder or have a serious mental health issue. They also created their own treatment model. Yeah, Renfrew's great. So congrats on that for you. Come and keep us posted how that job goes. Okay, sorry, I'm gonna get over here to Instagram. Y'all are like on fire today. There's a lot of questions. I like it. Could a doctor, there's that question. Yeah, I mean, you get nervous to get blood tests done. I want to validate that I think medical stuff is nerve-wracking for a lot of people. Having somebody stick a needle in you is nerve-wracking. Seeing your blood leave your body is nerve-wracking. You know, I think the labs, what I've seen happen, medical, sometimes people, eating disorders are so stigmatized, mental health issues are so stigmatized that often, rarely, people come to treatment to work on their mental health first. So what I see happen is somebody goes to the doctor and they get a bad report and then they are referred for counseling. But you don't need a medical issue. You could be totally on paper medically fine and have a severe, very significant eating disorder and or mental health condition. Mac and cheese is my comfort food too. We have some stomach stuff going on in my house. So here, I'm glad you mentioned the mac and cheese because I wanted to kind of talk about that, because I think that eating when we are sick is a challenge in general. And then if you have an eating disorder, it can feel even more confusing and hard to eat. You know, is mac and cheese the best lunch? I don't know. It's not the worst, and it is going to help my stomach. So sometimes we don't eat perfectly, and that's okay. We don't have to eat perfect. We just have to try to show up and honor our hunger. So I'm eating because I am very hungry. Just nothing really sounds good. Nothing really even tastes that great. But I'm here with you all. We're going to eat lunch together. You had a nurse have a panic attack last time you had your blood test? Oh, you were her first patient. Way to be a guinea pig for somebody. Yeah. Glad you got through that. What a way to have like the roles reversed, right? You're the patient and then you're having to like help the nurse through that. ICA 1982 should definitely try mac and cheese. It is awesome. You're right. You can make it a balanced meal. Add some chicken, add some veggies. I don't want any of that. I just want the carbs and I just want the fat. I don't want any flavor. So how do I handle, this is a good question too, a resistant client to treatment? So, man, I think that happens in my practice a lot, where people are resistant to go to a higher level of care, and I understand why. And I always tell clients, we're going to work really hard to keep your butt on my couch and in your life. But treatment sometimes happens. I also have the privilege of being an outpatient therapist, and I own my practice. And I'm also not your traditional therapist. I'm an ethical therapist. I'm just not your traditional old school type therapist. And I go back to the basics of meeting clients where they're at. So I would rather you be showing up to see me, and at least getting some kind of help, at least getting some kind of like feedback, at least getting some kind of something, right? And I will be gently, compassionately encouraging treatment. If it gets, of course, if somebody is super suicidal, if it's a crisis, then I can, it's kind of like, sorry, you don't get to make that choice. I can make that choice. I've never had to have somebody committed, knock on wood, because I think that I give myself permission to meet clients where they're at. And sometimes it's slow. Sometimes it takes a really long time to get somebody into treatment, and we do the best that we can, right? I'm going to show up and support you until you can go to treatment. So just like your therapist is encouraging you to show up for therapy, even though you're very resistant, that's work. Just showing up is work. I promise you, sometimes it doesn't feel that way, but just being there and doing the best that you can in that moment or that hour or whatever is sometimes enough. And hopefully you have a really patient therapist who, you know, is there. I'm a ride or die therapist. Like I will, unless you're breaking rule, right? There's that very specific confidentiality. If you're hurting yourself, you're hurting a child or like an adult, you know, somebody is being abused or in danger. If that is not the case, then what do we need to do right here, right now to best support you? And that looks different every day. That can look different week to week. So you have to be the guinea pig on most things. Denial is a normal part of having an eating disorder. Denial is a normal part of having, I think, a mental health condition. God, y'all, it's also scary to think about giving this stuff up. It's scary to think about changing. If I look at the psychology of an eating disorder, it's a coping skill. So it's really scary to think about not having this as a tool for you anymore. But I want you to know that treatment is good. Like treatment is... People go and get cancer treatment, you know, like they'll uproot their lives and they'll move to go and get cancer treatment. It's the same thing, right? You're allowed to make it a priority. You're allowed to take the time. You're allowed to take the effort. You're worth it. And I know you might not feel that way, but it's true. Like you're allowed to, it's okay to get treatment. There is no shame in it, but it feels really, really scary. It does. So what do I do if a patient is suicidal? It depends, you know, like that. If they are acutely suicidal, they need to be hospitalized. Acutely suicidal and not able to be safe, they need to be hospitalized. However, sometimes hopelessness and thoughts of death accompany mental health conditions. And I'm not a fan of putting people in treatment because they have symptoms of a disease, right? So how can we set up plans for safety and support. And I love a scale of like 1 to 10 for all things, a self-rating scale. If somebody's like a 9 or 10 on that scale of I'm going to kill myself, then we need to get you help. But if they're, you know, it's assessing a lot when somebody's suicidal, sometimes daily assessing and helping them. It's just about safety. So what do you need to do to be safe? If you can be safe, whatever we need to do that. Sometimes we have to go into treatment or the hospital to get that safety because it's hard for us to do for ourselves. But a lot of times people... If you talk about suicide and you can really sit with somebody and talk about it, they can come up with a safety plan, and there's a way to, you know, there's a way to like work through it. I hate forcing treatment on people. It happens sometimes. Sometimes it's necessary. As someone who's treated people who have been forced into treatment, I don't like treating that. Like, you don't want to be there. It's not fun for me. To this person who asked me on TikTok, the friend I never wanted, how do I handle a client just arriving to session with nothing to talk about? Do we just sit? Sometimes, but I'm able to get things out of them, to get them to talk. So it's not often that I have a client who doesn't have anything to talk about. Maybe it's something we've learned in school. I don't know. Sometimes we sit in silence, but that silence doesn't usually last for very long. I know, in 1982, that's why a lot of people are afraid to tell their therapist if they're hopeless and suicidal, because they're afraid to be committed. But I want you to hear me. It can be a symptom, and it's an uncomfortable symptom, but it's also a symptom that we can like treat, and it doesn't need to be treated in a hospital all the time. So to talk about it can be the thing that fixes it, the thing that helps you be safe for another day. But I also think you have to trust your treatment team too. So do I ever get triggered by clients? Yes, but not for what you would think. I'm a person, I'm a human, I have feelings, I have a life. Personally, my life we've been through a lot in the last 2 or 3 years. And there are clients who are sharing their stories, and I can sometimes relate to what they're going through. I'm in my own therapy. I do a lot of like self-care and journaling and meditating. And, I try to I honestly put myself first. I have no problem saying that and no problem doing that. So if I am super triggered, I have a lot of support and help in my life to help me, work through that. You would love a one-on-one with me. Well, I can't handle adulting. Let me tell you something. You might be able to do that. If you go to recovery-academy.com, you will see options for how to work with me. There are options to work with me virtually. There are options to work with me in a group setting. There are options to work with me one-on-one. And that could be a, hey, one-time check-in type of situation, or it can be, as ongoing as you need it to be. So if anybody is interested there's lots of different options, because I want to try and make it affordable and doable for people. So recovery-academy.com, I teach y'all everything I know about the treatment of eating disorders, and I give it to you in like non-clinical, I just everything I've learned from my own studies, my own experiences, and now my work in the field. I teach it to you in the Recovery Academy and give you all the worksheets and tools and everything I give my clients. It can be a one-time, 1982. It could totally be a one-time thing. It's I think you're going to want more. I'm just saying. But there is an option for a once a month kind of a thing, or there's even an option for a one-time thing. But I'm telling you, recovery isn't a one and done sort of a thing, right? Have you ever cried in front of a client? Yes. Not a lot, but I'll get a little teary. I have some clients dealing with some grief right now. I'm also personally going through a lot of grief in my life, and it's just hard to not feel. I tell my clients in the first session, I'm not a blank slate therapist. I'm not going to just sit there and stare at you. You're going to see my emotions because I'm a human and I have emotions. And I think my job is to more or less model emotion. It's not about not having emotions. Like I told a client earlier today, anxiety isn't bad. It's a normal human emotion. It becomes bad when we exile it and we tell ourselves we shouldn't or we can't have these feelings. So I don't ever want to send the message that a feeling is wrong or bad, or that you should be shamed for the way that you feel. So I try to model that with my clients. And I certainly have feelings in sessions, but I keep it professional. I hope. I'm sure I do. I have a lot of supervision, consultation, and again, therapy to try to keep my shit for my shit and not bring it into the session, but will let clients know, hey, what you feel is okay. And like what you feel, I feel too. Like it's okay to be, God, that connection, right? Our feelings make us feel so alone. Like there's nobody who relates to us or nobody who can understand. And then to have somebody who says, hey, you know, I kind of feel this way too, or I've felt that way too. It can be powerful. Should you get your septum pierced without your parents knowing? Oh, don't ask me that question. That's not fair because I'm a rebel and no one can tell me what to do. And my parents really struggled with the rules that they had for me in my house. But if you do it, that's your consequence, right? Like you're choosing whatever may happen when your parents find out. So, do you want to be in trouble? But getting your septum pierced is cool, right? Like, it's cool. I just don't want you to get in trouble. Is the best way to heal from an eating disorder to be open about it? Yes. The best way to heal from anything is to be open about it. These things don't just go away. If we hold on to it, it only gets worse. It can be hard to talk about, but it's okay to talk about it. This mac and cheese is really good today, y'all. My shirt says enough is enough. Wait, I think. Yeah, enough is enough. It was from Target in February during Black History Awareness Month. Getting support when you have a disability only makes it harder. I think that more programs and services need to be created considering somebody with a disability in mind. Because this able-bodied folks, we can fit in anywhere, right? We can. So if we kind of worked from a place of, hey, let's say, how would a disabled person be able to access these services? Let's start there. And then everybody else will be able to get those services too. There's a spicy Cheeto mac and cheese. That sounds very interesting. I can't handle adulting. How do you tell people you have an eating disorder? You don't have to go around telling everybody. You don't have to wear it on your forehead. It's not a badge that you wear. It is only something that you talk about to a safe, supportive person that you trust. So coworkers may not be on that list, right? You tell a therapist, you tell your best friend, you tell a partner, you tell a family member, you tell like somebody you met in maybe like an online support group. recovery-academy.com. We have those support options. So it's a bunch of people who are going to already know what you're going through. Those are the people that you talk to. Not everybody. I love Cheetos. They're my favorite. But only the crunchy ones. I don't like puffed Cheetos. I mean, I don't not like them. But if I get to choose, I want the crunchy Cheetos. They're my number one favorite chip. Your girlfriend knows and is supportive. Sometimes one person knowing is enough, truly. But these things are a part of us, right? Like our feelings are a part of us. Our illnesses are a part of us. And we, for so long, have been told, exile it, get rid of it. Those things are wrong, bad, weird. And I work from a place of, okay, it's a part of you. Okay. How do you let that part of you not run your life and run the show, but you also don't have to dismiss it and exile it? How can you accept it and love it as a part of the person that you are? I know I make that sound way much easier than it is, but that's like the gist of the work that I do with people. We do have good food and cool food. You just say good. We do have cool food in America. Sometimes. I'm from Texas, and so we have family in town this weekend. They were in Colorado, and they were talking about how the food in Colorado is not good. And they were loving like the Texas barbecue and the Texas Mexican food. So Texas food is real good. You have cerebral palsy, and it's true. You have a hard time finding a therapist that can work. Try looking for a therapist who works with like chronic health issues, or sometimes they do specify that they work with disability. I work with quite a few of disabled folks in my practice because you know why? I think this is a theory. I'm pretty sure we could like find research for it, but I think that when you have physical health stuff happening, it fucks up your relationship with your body, which fucks up your relationship with food. So, that's part of the work. And again, we can't exile the disability. It is a part of who you are. It's not fair. It's not right. Okay. How do you love yourself and care for yourself when you have these things that you're struggling with? Texas barbecue ain't got nothing on KC barbecue. I've never had KC barbecue. I'll admit I'm not a normal Texan. I do not like barbecue. So I probably will never. Well, I guess I could try Kansas City barbecue. I probably should. Especially because you said it's better than Texas. So I'll go to Kansas City and I will try the barbecue. Can't get good chicken in Texas. I wouldn't know otherwise. I mean, chicken is chicken to me. How do you know that? Where are you eating chicken? Why is it so much better where you're at? Cinnamon butter. All butter. So butter is like a gift from God. I love butter. I really need to go to Kansas City. You're making me want to go to Kansas City. What does one do in Kansas City besides eat barbecue? Like, I'm all about going to a place to eat, but like, what else should we do in Kansas City? Breakfast burritos. Pop-Tarts, so good. Man, I hope that y'all are enjoying these foods that you're talking about. Pop-Tarts, mac and cheese, Cheetos. Go to Sweden to eat? Totally. You don't even have to like convince me of that. I'm down. How did you get past focusing on the numbers of food? Intuitive eating. And it's crazy. Crazy is not the right word. If you can stop tracking it, like on your app, delete the app, or however you're calculating it. If you would stop the behavior, that doesn't instantly stop the brain. Your brain knows, but the less that you engage in that thinking and that behavior, the more it quiets. So if you think about what's happening neurobiologically, you have this thought, right? We have thousands of thoughts per second, per minute. Like, it's crazy. Our brain does a lot. And if we then engage the thought, like, you know, focus on it, send energy to it, indulge it, what we're doing is we're sending more chemicals to that pathway of the brain, making that pathway stronger, more prominent. So those counting numbers are more quick. I kind of call it like it's an automatic highway, right? So the trick is to recognize, oh, I'm counting these numbers and I'm going to send my mental energy elsewhere. I don't want to spend, I can have the thought, fine, it's there. That's an eating disorder thought. Now I'm going to send my mental energy. I'm going to tell my brain I'm going to focus on something else and send the chemicals there to keep them from going to that pathway. And then the less that we engage pathways in our brains, they die or they go away over time. Butter is too good. Mm-hmm. Try some mac and cheese if you're scared to try new foods. Everybody on here is talking about how good mac and cheese is. That can be, it's this, noodles and cheese. And butter and milk. Or if you want to spice it up, put a little pepper on it. Yeah, ICA 1982. Here's another one too. Putting like stickers or covering up the nutritional information of boxes and food. That can help you too. Milk. I love dairy. I'm a dairy girl. All right, friends, I'm looking at the time. I would hang out here with y'all because this is a fun crew, but I do have to finish my lunch. I talk too much, don't eat enough, and I have clients and work and stuff to get back to today. So I love Canada, but I will totally come back to Canada. So I'm there. So friends, I'll be back on Monday next week. So join me 12:15 Central Time. Exactly the same. So there's somebody from Canada on TikTok too. Cool. I like, hey, Canadians. But I'm going to go. If y'all want to connect with me, if you have any questions, you want to know more about the resources and services and products I have, recovery-academy.com. I'm telling y'all I have so much like learning and information for you on there, and I try to keep it like simple. It's not daunting information, right? So you can hit me up there or on all of these social media sites. But I will see y'all next week. Bye. I don't know how to end this. Now I do. Okay. Bye.